Okay, welcome you guys. Ralph Havens here, physical therapist at Beyond Limits Physical Therapy in Bellingham, Washington, in Fairhaven. And I'm joined by my good friend, longtime teacher and colleague, Dr. Tom Giammatteo, naturopath, chiropractor, acupuncturist, physical therapist, and co-developer of the method that we use, integrative manual therapy. And today's podcast is one I think is one that I'm really looking forward to. And it's about hormones. And, for athletes, we know a lot of athletes take those performance enhancing drugs. They're illegal, but that is a thing. And there's a reason they take hormones and all sorts of stuff. But I'm also seeing a pattern with the women athletes and women active women dealing with a lot of symptoms, from chronic pain to fatigue to depression, anxiety, to things about questioning everything about their life. And as I've been looking through Dr. Kelly Capperson's book and her information, a local here in Bellingham has a great book called Menopause Moment. I'm realizing, my goodness, a lot of the symptoms that people go see doctors for and also talk therapists seem to be related to hormones a lot. So I've got a lot of questions for Dr. Tom, but I want to open it up to him first with any thoughts he has about hormones and perimenopause, and maybe even go into the performance enhancing drug idea, testosterone, EPO. Like, hormones do drive a lot of action, and IMT has a different approach to hormones than some of the practitioners. Dr. Tom, thank you for being here. I'm excited to hear what you have to say.
Hi, Ralph. How are you?
You can tell I'm fired up.
Okay. So we're going to have another talk later on the avenue of a new science of medicine called structural medicine, which is the new launch name for integrative manual therapy.
That's
so
perfect.
We're taking beyond manual therapy and we're bringing it into a word, structural medicine, where we use body work and supportive structure to look at the human condition. The allopathic or Western model, like you said, is involved with hormones. And the hormones, ONE at the end, and testosterone and progesterone and estradiol are all using the same ending word, okay? And structural medicine is about optimizing human potential to the best of its abilities. We have some subcultures in the world that have centurions, people living over 100 years. Okay?
Yeah.
And if you look at their history, they had sexual function all the way through maybe 80, 90 years old. So the lack of testosterone, the lack of estrogen is still a disease process for me.
It's not just totally a natural. There's things that happen after you're 40 and 50, but there's
well, what we found in our research of using IMT and all our clinicians, we have women menstruating up to 55 to 60 years old. And then one day it just sort of disappears. And the hot flashes and the pains and everything else is still a dysfunction for me. It's just perimenopausal PMS, let's call it. So going back to Dr. Tom's menstrual cycle, and going back to the full history of life, no woman should ever have PMS. So if they have PMS, of course they're going to get menopause or menopausal symptoms, right? It's just, it's a broken car and it's going to be more broken at the end.
Yeah.
So ideally, Dr. Tom's observation and structural medicine's observation, which I found in chiropractic and osteopathic philosophies also, say, sorry, I have a machine going off here. I should shut off in a minute.
It's okay. I don't care.
So should say a natural change in the flow of the menstrual cycle should stop around 60 years old.
Wow.
And menstruation up until that point, up until your 50s, should be 28 to 38 days, 3 to 4 days of light to moderate bleeding, and 1 cramp and nothing else. No mood swings, no acne, no back pain. If that's there in Chinese medicine and Ayurvedic medicine, we know that the liver isn't having the capacity to clean up the sexual hormones just as much as it has anything to do in life. Okay. So that going back, and you got to look at the pictures, you got to look at how is this person doing all the way through those things, right? So HRT, hormone replacement therapy, um, is something to get the symptoms down and could be used while you're doing the other lifestyle changes, but it's not, it's just putting a Band-Aid on the problem. It's not fixing the uh, iceberg underneath the whole process.
Fixing the structure of the body and optimizing it for function, you might still benefit from a little HRT just to help with the symptoms. It would be kind of like taking an aspirin for the headache while you fix up the reason you have a headache kind of thing.
Yes. Okay. So remember I said hormones, testosterone, progesterone. So there's also there's also cortisone and progesterone, which is
Estrogen.
cortisone, which is a steroid, right? They inject in to stop inflammation into the area.
Yeah.
So in chemistry, the names are ON means steroid. And it has this little octagon chain on it. So the word ON is a steroid. So would you be comfortable putting steroids in you? So birth control, progesterone and HRTs are putting steroids in and not fixing the problem. It's changing the problem.
It's kind of like the aspirin for the headache. It's not fixing the reason you have a headache, but it
Right.
might
It's
help.
numbing up the nerve so you don't feel it. Right.
Yeah.
So
And is estrogen, I mean, estrogen has a different ending, GEN. It's still
well, it's estrogen, but if you really look up, there's 6 different phases of estrogen, and most of them are called estradiols or estrogens in the back end.
Thrones. Okay.
It's called estrogen.
Gotcha.
So that whole hormone chain is there. So we've talked about in structural medicine, Dr. Ragland's sign and pupillary reflexes. And we use them every day in the clinic here to examine how much cortisol somebody produces,
Oh, let's hear about it.
right? So the Ragland sign was in the 1890s, and Dr. Ragland observed that if you take somebody's blood pressure when they're lying down, you
Oh,
wait
yeah.
5 minutes and you take it, then you have them sit up and immediately take the blood pressure again. And then you take another blood pressure when they stand up. And then 2 minutes after they stand up, you take another blood pressure again. So lying down should be the easiest blood pressure because everything's on the same floor, right?
Yeah.
Get to your head. And then as you sit up, it should go up 10 points. And if you go sitting up again, it should go up another 10 points. So let's say your blood pressure is 120 over 80. And then it goes up to 120, 130, and then 140. And then after a minute standing, it goes back down to 120 again as the body regulates.
Okay.
That gives us a picture of cortisol, which is the precursor to all those other HRTs.
That's cool. We did that test and I tested good.
Right? So we want to see that. And when it goes the opposite direction, it actually drops 10 points. So it goes 120, it goes down to 110, and then goes down to 100. I've had patients go 120, drop down to 80, and then drop down to 70. That is called orthostatic hypertension.
Yeah.
Okay. So the muscles that are in the artery walls respond to cortisol. So you go to your naturopath, and MDs don't really like to do this, and check your cortisol levels. And they will actually measure them every 2 hours through sputum testing. And cortisol should actually peak at 3 o'clock in the morning and then go down there. And cortisol is the beginning of your wake up cycle. So you're waking up at like 5 in the morning. Before we had electricity, before we had alarm clocks and everything else, everybody got up at sunrise.
Yeah.
Right. So cortisol starts 2 hours before sunrise happens. So that's your wake during sunrise. And in Ayurvedic medicine, they say that if you sleep past sunrise, you start to lose some energy. So the more you hit the snooze clock on Saturday, the more you feel tired. Usually getting up at 7 in the morning, and Sunday you're sleeping in, and by 2 o'clock on Sunday you're still feeling more tired because you've slept into the next cycle.
Yeah, I have friends and their teenagers sleep till 11 or 12, and they're like, well, it's teenage years. And we have a teenager, he gets up at 7 o'clock every morning, whether he's got school or not. Sometimes
Yeah.
even earlier.
Right. So that rhythm is messed up, and the other side of that rhythm is your second wind at the end of the night. So you should be going to bed like an hour after sunset, ideally. And that's when your melatonin increases and everything else. And we're taking melatonin at 11 o'clock when it really should be at sunset, type of things. And so if we feel that urge to look at the computer or start writing at 10 o'clock at night, we're
Yeah.
starting to lose the energy that would have gone into detox ourselves, and it goes into our brain. So that over years is another mess up of those cycles. So yes, we have more hormone deficient people, lack of testosterone. Back in the 90s, they used to say that the average age of a hysterectomy in the United States was 45 years old. And that's the mess up of the total hormones with fibroids and everything else. And if
Wow.
you went to other cultures, so if you compared, and it's even worse now, I haven't done the research, but it is worse now, that if you take the average hysterectomy in the United States is still around 40 to 45 years old in the United States, and it's 8 out of 10 women.
8 out of 10 women?
Yes, right?
What are they
So,
doing for? Is it because they have um like pain or
well, because we could do gynecology now, it's very high, right? So if you take that same thing to France, it's 1 out of 10. And if you take it to Indian primitive culture, it's 1 out of 20, right?
that's crazy?
So you were saying how you're reading this book and how deficiency in estrogen or deficiency in testosterone. But my question in structural medicine is if we're making it in our 30s, why aren't we making it in our 50s and 60s and 70s?
Yeah, and why is it not just like perimenopause happens, menopause happens, and it's a smooth ride instead of this
Right.
like
And there's no such thing as really perimenopause. That's an indication that we have a weakness in Chinese medicine of kidney and liver,
kidney and liver. And
right?
so yeah, and I know you're going to get
There's the mythical woman that, at 12 to 14, she gets her period, never really knows it's there, shows up on every lunar cycle, and then she has children. She doesn't have morning sickness, and she gets into her 50s and 60s, and the cycle starts to dry up. They never have hot flashes. They never have this PMS, the perimenopausal, is a disease society. So
yeah.
stop. I'm saying this out loud to say we are sick beforehand and we're denying we're sick. And medicine just says, oh, just take another Motrin. You know,
Yeah.
I,
Yeah.
we grew up in physical therapy, and it's mostly a predominant women's profession.
Yeah.
And they're also healthy and they eat more. So the attempts of, the PMS symptoms is less. And that's one of the things that helps regulate in structural medicine by, the second or third month. That's one of the things. How was your menstrual cycle? Did you have cramps? Okay, we may need to add calcium, we may need to add zinc, but we're using that as a meter, and it's a really good meter of how their health flux is. And my ultimate goal in women's infertility is to get them to have a perfect cycle for 3 months before they get pregnant. So at
Oh my,
least all their filters are healthy. So the
I mean,
question is, oh my God, I have low testosterone. Oh my God, I have low estrogen. Yes, if boy, the cream really works, wonderful. But that's not the answer. That's still saying, okay, we have to give you, how do we figure out how to make the body produce all the way from cholesterol all the way through the liver cycle and have the body prioritize to get their testosterone up again?
so yeah, so then what is this IMT approach, this structural medicine approach? Like, how do you help somebody then?
Well, it's looking at the cofactors because every time you have a pain, that takes a little energy from you. Every time you're stressed, we talked about a descended sacrum,
Yeah.
and they have candida, they have yeast, they have possibly a disease process in there, right? People shouldn't. Um, I met a 72-year-old woman the other day, looked like she was 50. She exercises, she walks, she talks, and it's society and the choices that we were told, we if we want to take responsibility back for ourselves, we were
Yeah.
all lied to how to stay healthy before. And you found that out when you were running and you got fluoride poisoning from the public water system from San Diego.
Yeah. Yeah. I learned a few
So,
different times along the way.
yeah.
Yeah.
So our public health system, our school system, giving kids meals every morning is going to make, they're including gluten. Kennedy just rotated
The pyramid.
pyramid. Sugar should be a poison in the next 20. I would hope to say that we could live and see sugar as being one of the most carcinogenic poisons that we put into our system, causing the diabetes and gluten and all those pieces. But if you're still eating gluten, you're complaining about perimenopause, well, get off the inflammatories. You probably won't have it.
Yeah.
Let's fix your diet. And they are real symptoms. They are changing people's lives. So
Yeah.
the other piece of this, Ralph, is that why do some women have fibromas or why do they have cystic breast
Yeah.
disease? In biochemistry, if everything's flowing, those problems don't happen. But if you get a buildup of estrogen 2, and estrogen 2 goes to the breast, estrogen 4 goes to the walls of the muscles. So the fibroma in your pelvis isn't really the problem, it's the symptom of having this liver that can't produce this, and the body is being told to add extra muscle. You didn't exercise your uterus to grow a fibroma,
Yeah.
right?
Yeah. Yeah.
And the same thing with the prostate. We are toxic, right? We're eating poisons, we're eating pesticides. And they say everybody before they die for males will have prostate cancer.
Mm.
Well, if you really look at the physiology of infection, when you have a big white pimple on your cheek, if you biopsy the infection around it, you still have stage 4 cancer in it. But the body's able to take care of it if it has enough tools to do that. So the symptoms are real that we get depression, we get anxiety, we have couple breakups and things like that. HRT is, okay, this is working, so we got to figure out how to do it in the body.
Yeah. And
Right?
so then, I know the idea of structural medicine, but for people that are like, well, why would you go to an integrated manual therapist and have them put their hands on you and do techniques to work on the liver and the kidneys and pelvis? Talk a little bit about we can talk. Hopefully, we have enough time to talk about some of the supplements, the herbs you like, but for the structural piece,
Okay.
talk about that aspect for somebody that maybe would be like, what? You're going to put your hand.
Well, yeah, okay. So structurally, right? Um, Structurally, our liver lives between our rib cage. Let me see if I can see myself here. There you go. Our liver lives here, and it goes all the way across. And it's a factory, and it has to do 1,000 chemistries in a day to be super healthy. Okay. If we make the factory 50% smaller, what are we going to do with the machinery in there? It's going to be overused, right?
Crowded.
Crowded, right? So how do we expect 1,000 chemistries to come out of here when it's supposed to be coming out of here? So the structural therapist will get that liver to open up or work properly in that whole process, and then the chemicals go better. So when we're suggesting nutrition, we need only 10% of the nutrition because the machinery is working perfectly fine.
Yeah.
Have that. So many people, there's been alerts in paper on fatty livers. Well, if we were outside walking every day, if we were farming every day, we'd be standing up, right? And with a cell phone posture sitting at the desk, we're like this, and our liver gets tight, it doesn't move. So every time I breathe, every breath I take, the diaphragm pushes down, the liver gets squished and almost wrung out like a rag. And then as we exhale, the diaphragm goes up and it pulls in liquid and comes back. The heart doesn't push all the blood.
Yeah.
It has to come. So the piece of respiratory, ringing out and releasing, causes that flow. But if we're stuck down in this bent over posture, we're going to get clogged pipes faster, right? So this idiopathic fatty liver that everybody's getting is because they haven't moved, they haven't worked, and everything else. So that fatty liver congestion, and that was done in 1998. There was iPhones are causing fatty liver just by the posture of doing that. We don't move, we don't have those things. So that's another reason for that whole piece. So the lack of cortisol. So the first one was do your blood pressures in these 4 times, and you want to see how they drop. And the second one is have somebody take a pen light and shine it right into your eye, not fully, just on the corner. So if this is my iris, right? I start bringing the light in like this, the iris will close down, and just keep it there. You don't shine it fully in because you can not, it really gets people pissed off. So you shine it in, get a little light in there, it closes down. It's supposed to hold for 10 seconds to 30 seconds. When it starts to bounce, because that's driven by cortisol, those muscles use that. So it's supposed to hold 10 to 30 seconds. If it doesn't do that, we know that we're having a lack of cortisol. We have to make our own cortisol. Are we feeding ourselves the right food, or are we using diet soda that's killing the cortisol?
Yeah. So if the iris starts to like open real quick, it's
or just pops open because it's gotten totally exhausted. It's like trying to do 10 reps with a bicep curl and you got to 8 and it just
stops. Okay.
So that tells me cortisol levels, and that's adrenal stress. Are you sleeping long enough? Are you having good food? Do you have pains in your body that are pulling you? So all those adrenal things, they're dings in the car, right? So 2 people having 2 exact cars, one brings it inside a garage and he polishes it every month and changes the oil. And then you got the other car that's all rusted out, same environment, same roads. And that's what perimenopause is. It's a crappy system that they probably had birth control when they were younger, and they probably had acne and allergies before when they were younger, and all those things. Or now they're super stressed and they're not getting the good food and the quality of it and doing that. So our GI Regen has ashwagandha in it, which supports cortisol production. It has tribulus in it, which helps estrogen and testosterone production in it. Also has cranberry for cleaning up the bladder. Also has uva ursi in it to get the gut really healthy. So if we don't have this system, if they have leaky gut, why not have perimenopause?
Yeah. So we got the GI Regen with some really good herbs that help with the hormones, and then we got the structural piece. There's techniques like Tom's talking about the liver and structure. There's an entire liver class in IMT. There's one technique, just the strain counter strain of the liver. That's a 90-second technique that restores how this liver moves. It's really quite amazing. And I did a technique like that, a strain counter strain on a colon, a sigmoid colon, and totally loosened up somebody's hip. So when Tom talks about the structural medicine piece, there's a hands-on process that we can use to find how is that liver doing, and some hands-on techniques to get the house of the liver better. So I wanted to make sure that's known.
Right. So, your doctor's talking, yes, HRT, if that's the key that's waking him up. If you're just going to go 8 hormone replacement, you're just putting a big Band-Aid on it and you're causing more processes of it, right? So, but it's been an institution of mankind since before Christ, right? In Ayurvedic, in Indian medicine, and in Chinese medicine, there's writings that they would take the tweens, the pubescent children, collect their urine and pass it on to the elderly so they would feel good.
Wow, isn't that interesting?
And all the cultures, right, when you're hunting a lion or an elephant and everything like that, the elderly would get the organs first.
The liver, yeah.
The liver, the brain, and everything else. And our whole population is deficient in all those things. We're just eating muscle meat. We're not eating organ meat. So now there are some advertisements out there of, organ pieces. There's even, mothers that eat the placenta because it's enriched in all those vitamins. All those different deficiencies make this big puzzle up. If you're just counting on the HRT, you're going to get a dose, and next year you're going to need to double it, and next year you're going to triple it, and you're just burning out the whole system instead of repairing the system.
So
I'm happy if that's a resolution and says this is the problem, but we're not fixing the liver and kidney and building it back up again.
So there's an IMT approach to fixing the house of the liver, the house of the kidneys, the house of the pelvis where the uterus, or for men, the prostate is, and letting things work better than giving it the right kind of nutrition, not giving it the stuff that can hurt it, and then some powerful herbs. What about immune regen? When I first met you years and years ago, we were using, I think, like 10 different supplements, and you combined a bunch of stuff into one. Is that a thing that would be useful for everybody as well? What?
And yeah, so my wife is an immigrant from Russia, and her friends in the area are having colds, and she'll go, Tom, talk to them, and I'll just pass on, just say take immune regen and GI regen, and they're just using it like a vitamin C. And I've had 4 families come up, oh my God, I feel so much better. I feel like, so the immune regen actually reports to the thymus gland and takes away autoimmune diseases. Right?
So can you just real quick go through what's in immune regen? I mean, I can look it up on the
Yeah.
I
Immune
will
regen,
link below,
so
guys.
structural medicine. In Western medicine, the thymus gland sits right here. Okay.
Yeah.
In literature, you'll find that it does, in regular physiology literature, they make one sentence, it shrivel up and does not do anything after the age of 7 years old. However, your white blood cells come in 2 categories. You have the white blood cells, and then you have the killer T cells and the killer B cells. Those cells are young stem cells that come out for the immune system. And if you have any bright doctor, you can ask them, what does the T in killer T cells means? And they go, I don't really remember. So that means that those groups of white blood cells go to your thymus, walk through the library and make sure, oh, I had measles, I had mumps, I had this, I had that. And they stack it on the outside of the white blood cell and they go on patrol. So when they see a little problem, they can just kill it. When it doesn't happen, and now that white blood cell has no information, it's pretty blind, it's going to bump into something and says, well, I don't know what to do with this, I'll just kill it anyways. That is the word autoimmune disease. That is Parkinson's. That is diabetes. That is all the thyroid issues, Hashimoto's, that is the cancer. And what you hear, especially the advertisement where they're showing the eczema, the skin rashes going away, they're suppressing the immune system and they're stopping the fight. So, but the bad guys are still working in the background. So when you hear that one, like never have, all the diseases at the end, make sure you have a good liver and all that stuff, they're stopping the immune system. Autoimmune diseases, you don't know who you are and you're eating yourself up inside. So between GI regen supporting the adrenals and helping the gut get balanced again, and the immune regen generating the thymus gland and allowing the white blood cells to get younger again. So we use that to regenerate. So sometimes in my office, I think they're so sick, we have to get the gut ready to get the immune regen in. But you can still,
then they can take the immune regen.
yeah, but otherwise, I would just say take one of each twice a day and try it for 3 months, and you feel brighter, better, and healthier than ever before. There's nothing, and the herbs in there are multi. There's some glands in it like thymus, tissue, spleen. There's glutathione. There's acer campestri. All things that have either antiviral or regenerative comparisons that make the white blood cells work better.
Cool. I'll go put links below and get the ingredients and just list it for people so they can look at that and talk to your doctors, your naturopaths, your people.
Right. So we were talking about how this drives relationships crazy and people are in perimenopause. Yes, I agree, it's a terrible disease. And again, if the HRT changes it, then my goal is to try to recreate it that they're not hurt inside anymore. But if they had PMS once, and women are, it's a gift to God that they be able to control that, but they're sick. And IMT has like a 95% change in the health of that menstrual cycle if we can clean them out fast enough.
Yeah, I know when Ben was pregnant with Baden, you and I were in a lot of communication, and I was working on Jen with this structural approach, and man, her body felt great through that whole cycle. No morning sickness, everything's moving great, great delivery. It's really amazing to see when things are optimized. Thank you, Tom, for this. It's definitely good. We'll do another one and go even more in depth and men's hormones, talk about that a bit.
Yeah.
And maybe even get into the performance enhancement for athletes. I was watching a podcast yesterday, and they were talking about, well, for runners, they're running so many miles that nutrition rules are different. You can just throw in a bunch of crap that just has lots of calories, and it's like, well, they were like, if the fire's hot enough, you can just throw anything in for fuel. But there is a way to still get enough calories and carbohydrates and
Right. And so I support a bunch of ultimate marathon runners. They do 6 marathons in 6 days through the Mojave Desert and stuff like that. And we gave them medical foods for powders that were almost like baby foods, so they would be absorbed perfectly. And the recovery time was like 2 days after doing that type of thing. But yeah, there's potential. And again, it talks about our environment, how crappy our environment is. And a lot of people are going, oh, there's nothing wrong with creatine. Oh, there's nothing wrong with this piece. Well, we're deficient in our food models. We should be able to get them in our food models to really do it. But again, our food is crappy. So
get the best food, and then these supplements can help. And then for the structural piece, talk to Tom more about this. He actually does short consults if you want that. And I'm over here in Bellingham. So Tom's in West Hartford, and IMT Wellness Center.com, 860-561-2286. And I'm on the West Coast, ralphhavens.com. And Beyond Limits Physical Therapy. So reach out to us if you have any questions. If this resonates with you, share it with people that could use this help. There's a lot of different ways to help people. And we feel we have a very upstream version, like get to the root cause. So Tom, thank you for going over with us, and we'll do another one and keep going with this, and I'll put links below and send you all.
okay. Thanks, Ralph. Appreciate
Thank you so much. Really appreciate this. Okay, you guys.
Bye.
Bye.